Today on PlacidWay Pulse, we're comparing Thailand and South Korea for medical and beauty travel, including cosmetic surgery, plastic surgery, anti-aging treatments, recovery support, and international patient care.
This episode is for educational purposes only. It is not medical advice, diagnosis, or treatment recommendation. Anyone considering treatment abroad should speak with qualified healthcare professionals, review their medical history, and ask detailed questions before choosing a provider.
Right. So let's just unpack this, because I think usually when you're planning a trip somewhere new, your biggest worry is, did I pack the right adapter plug or maybe figuring out the subway system?
Yeah, exactly. The normal travel stress.
Right. But when you're traveling for a medical or an aesthetic procedure, the stakes are just, well, they're so much higher. You are navigating an entirely different landscape. And to really ground this deep dive, I want you to imagine a patient. Let's just call her Maya.
Okay, Mike.
Yeah. So Maya has been researching facial rejuvenation and beauty travel for, months. And she doesn't want a completely different face. She just wants to look fresher, a bit more rested, and confident. But right now, she is completely paralyzed by the choice between Thailand and South Korea.
Oh, I'm sure it's a lot.
It is. And honestly, looking at the sheer volume of information out there, I get why that would feel overwhelming.
Yeah, it really is an avalanche of information to sift through. What Maya's facing isn't just a matter of picking two geographic locations on a map and, comparing prices.
Right, it's way deeper than that.
Exactly. She is trying to compare completely different medical philosophies, and choosing the wrong clinic or misunderstanding the recovery process, or just being influenced only by heavily filtered online photos. Those are very real fears.
Terrifying, honestly.
Yeah. So our mission for this deep dive is to provide a practical roadmap for Maya and, well, for you listening. We're going to strip away the marketing hype and break down the distinct medical cultures, the technology, and the actual recovery experiences of South Korea and Thailand.
Because before you even look at booking flights, the very first barrier you hit is communication. And that's not a small decision.
No, not at all.
Maya's real questions, the ones keeping her up at night, are things like, will the doctor understand the look I want? And will I speak with the actual surgeon? Because at the end of the day, you're not just choosing a clinic, you're choosing who you trust with your body.
That trust is everything. But, how that trust is built looks remarkably different depending on where you land. So let's look at South Korea first, specifically in hubs like the Gangnam district in Seoul.
Okay.
Trust there is really built through data and just hyper precision. The consultation process is intentionally objective and it's fast-paced.
Fast-paced meaning?
Meaning from the moment you walk in, they're utilizing advanced Vectra 3D imaging, artificial intelligence skin analysis, high-resolution dermal mapping.
Wow. Which, to Maya, might initially feel a bit clinical, maybe? But I'm guessing there's a huge benefit to that. They're basically mapping the structural integrity of the face.
Down to the millimeter.
Yeah.
The goal is to measure the underlying skeletal and muscular features so precisely that they mathematically prevent that, that uncanny valley or overfilled look.
Right. Nobody wants that.
Exactly. They want to show you the science of your facial harmony on a screen before a scalpel is ever lifted. Now, because they deal with such high volumes of international patients, the environment runs like a highly efficient machine.
Gotcha.
And it's worth noting that while the surgeons are world-class, they frequently rely on dedicated in-house medical translators to communicate with you.
Oh, interesting. So South Korea sounds almost like you're working with an elite architectural engineer. Like you get a highly detailed blueprint, everything is measured by AI, and it's driven by absolute precision.
That's a great way to put it.
But if that's the Korean model, what is Thailand doing differently?
Well, if we look at the cultural framework of Thai healthcare, it's deeply rooted in this concept called omotenashi, or in Thai, namjai, which translates to water from the heart.
Water from the heart. I love that.
Yeah, it represents this profound, genuine hospitality. In Thailand, trust isn't necessarily built by staring at a 3D dermal map. It's built through unhurried, holistic conversation.
Meaning they actually sit down and try to figure out who Maya is as a person before suggesting like a facelift or something?
That is the core of it, yeah. The consultations are lengthy. The doctor wants to understand your aesthetic goals, of course, but also your lifestyle, your stress levels, your sleep patterns.
That's a huge difference.
It is. And the English proficiency among the medical staff in top Thai international hospitals is very high. So you're often communicating directly with the primary surgeon without, filtering your anxieties through a translator.
That is a massive distinction for patient comfort. I mean, if South Korea is the elite architectural engineer, Thailand sounds more like visiting a bespoke wellness retreat, where the doctor takes the time to learn about your entire lifestyle before they even touch your face.
That analogy highlights the divide perfectly. And neither approach is inherently better. It just depends on what makes the patient feel secure. Does Maya want clinical mathematical certainty, or does she want a holistic conversational partnership?
Right. So let's assume Maya has had her consultation. She feels understood. Now we have to talk about the actual medical execution because Maya wants natural results. She wants to look like herself, just refreshed.
Right, the untouched look.
Exactly. And I think we all know these countries are giants in the industry, but how do they actually differ in what they do best?
This is where we need to look at the surgical techniques. South Korea is universally recognized as the pioneer of K-beauty aesthetics. Their whole philosophy centers on delicate, natural-looking facial harmony.
Like facial contouring.
Yet, they dominate in V-line surgeries, jaw reduction, and highly complex procedures like Asian rhinoplasty.
Let's dig into that for a second. Why is South Korea so far ahead specifically in Asian rhinoplasty? Is it just the sheer volume of surgeries they do?
Not just volume, no. It comes down to mastering very specific anatomical challenges. Asian facial structures often feature thicker skin and softer, weaker cartilage compared to Caucasian structures.
Oh, I see.
Yeah, so in the West, a rhinoplasty often involves just shaving down a bump. But in Seoul, surgeons are world leaders in structural grafting. They use cartilage to build a strong, refined tip that can actually support that thicker skin without collapsing over time.
So they've perfected the actual mechanism of it. But what about the non-surgical side? Maya might just want some skin tightening. She doesn't necessarily want to go under the knife.
South Korea is the absolute epicenter for advanced energy-based devices. We're talking about high-tech, anti-aging lasers like Thermage FLX and Ultherapy.
I've heard of those.
Yeah, people fly across the world for them. Thermage uses radio frequency to bulk heat the deep layers of your skin. It essentially shrink wraps the skin from the inside out.
Shrink wraps the skin. Why?
Exactly. And Ultherapy uses microfocused ultrasound to hit the exact same foundational muscle layer that a surgeon physically pulls during a traditional facelift.
And I'm guessing the clinics in Seoul have the absolute newest iterations of these machines.
Oh, definitely. Often years before they become standard in Western clinics.
Yep.
And because they do these at such a high volume, they know exactly how to layer them, like using Ultherapy for lifting and Thermage for tightening in the exact same session.
That is wild. But here's where it gets really interesting to me. Thailand has a completely different area of dominance, right? They aren't just trying to out-laser South Korea.
No, not at all. Thailand takes a much broader approach. They excel in comprehensive full-body transformations. They lead in body contouring procedures like vaser liposuction, breast augmentations, and they're the global gold standard for gender affirmation surgeries. But when it comes to anti-aging, which is what Maya's looking for, Thailand approaches it through the lens of functional medicine.
Functional medicine, meaning they are treating aging as like a biological condition rather than just a cosmetic flaw.
That is a crucial distinction. Thailand blends aesthetics with wellness. The philosophy is that external aging, dull skin, volume loss, is just a symptom of internal biological decline.
Oh, that makes sense.
So an anti-aging package in Bangkok isn't just a laser treatment. It begins with comprehensive blood panels, genetic testing, and hormonal mapping.
So wait, it's like if your body is a classic car, South Korea is giving it a flawless, millimeter-perfect custom paint job. And Thailand is putting the car on a lift, flushing the engine, and rebuilding the transmission so it actually runs like brand new.
That is incredibly accurate, yeah. Once Thailand maps out your engine, they use targeted therapies. We're talking about NAD plus IB therapy to repair cellular energy, ozone therapy, even stem cells. They aggressively target aging from the inside out.
The sources we pulled highlighted two distinct patient stories that I think make this so tangible. There's a patient, let's say Sarah, who flew to Seoul. She wanted precise skin boosters, and she thrived in that clinical, highly detailed, data-driven Korean environment.
Right, she wanted that precision.
Exactly. Contrast that with David, who traveled to Bangkok. David wasn't just dealing with wrinkles. He was suffering from profound systemic burnout. He went for their holistic, anti-aging approach, got his hormones optimized, did the restorative NAD plus drips, and he recovered in a facility that felt like a luxury resort.
And that brings us to, honestly, the most critical pivot point in Maya's journey. You can have the best surgery in Gangnam or the best cellular reboot in Bangkok, But if your body reacts poorly to the physical trauma and you panic in a hotel room, the whole experience is ruined.
Right. Recovery is physical, but it's emotional, too.
It is the most vulnerable phase of the entire process.
Which definitely sparks Maya's next set of anxieties. She's thinking, where will I recover? And who helps me if I feel worried after the procedure? Because let's be real, she wakes up, she's swollen, she might be in a time zone 12 hours ahead of her family, and she is feeling incredibly fragile.
The post-operative environment is where the differences become incredibly stark. In South Korea, the recovery is highly structured, very urban, and hyper-focused on what they call de-swelling culture.
De-swelling, like they actively treat the swelling rather than just waiting for it to go down.
It's practically a science there. Clinics offer intensive VIP care to force the body to heal faster. They use hyperbaric oxygen chambers to speed up cellular repair, specialized lasers for bruising, and traditional Korean medicine, like the famous Korean pumpkin juice, called Unpacking.
Wait, pumpkin juice, is that actually scientifically effective, or is it just like a comforting cultural thing?
Oh, it's highly effective. Hobenke is loaded with natural diuretic properties. It literally forces your lymphatic system to flush out the retained fluids and rapidly reduces the inflammation.
Wow, okay, so you are actively being treated to heal, but you're still in Seoul. And something Maya needs to know is the culture of the city itself. If she gets surgery in Seoul, she's walking out into a bustling metropolis where people are literally shopping in malls with bandages on their faces, right?
Yeah, you won't get a second glance. It is entirely normalized.
Yeah.
But that raises an important question for Maya. Does she want to recover in a massive city, or does she need absolute tranquility? Because Thailand offers what we can call resort healing.
Okay, I have to push back on this a little because the sources mention patients recovering in luxury, hospital-partnered accommodations on the beach in Phuket or in tropical settings in Bangkok. That actually sounds like an infection risk to me, fresh incisions and tropical humidity.
I get that. That is a very common misconception. But when we say resort healing, we aren't talking about Maya lying on a sandy beach towel with open incisions.
Oh.
These are highly controlled, hospital-partnered recovery suites. They are meticulously climate-controlled and sterile, but they are architecturally designed to look and feel like a luxury resort. You're looking at a serene tropical garden instead of a concrete skyline.
Ah, so it's the illusion of a vacation, but the reality is a sterile medical ward.
Precisely. And that illusion has a profound biological benefit. Recovering in a serene environment actively lowers your cortisol levels. By reducing psychological stress, Thailand's recovery model actually aids the physical healing process.
Because high cortisol impairs wound healing.
Exactly. You get your bandages changed by a world-class nurse, but your nervous system feels like it's on a retreat.
Even with world-class nurses, what if Maya feels isolated? If she feels a twinge of pain at 2 a.m., she is thousands of miles from her local doctor.
Both South Korea and Thailand have dedicated international patient departments. You are assigned a concierge coordinator who speaks your language fluently. They act as your safety net. You are never left to navigate the process alone.
Which brings us to the final hurdle. We've covered the consultation, the procedures, the recovery, but we have to address the logistics that are definitely keeping Maya awake. She is asking, what is included in the package and what happens after I fly home? Because pretty photos online are not enough. Patients need real answers.
They absolutely do. And we need to talk about cost, but we have to frame this carefully. When we discuss Thailand or South Korea, we shouldn't think of it as cheap. Lower cost does not mean compromised quality. What both of these countries offer is immense value.
Right. I mean, the data shows patients are saving anywhere from 30 to 70% compared to Western prices. But patients really should compare value, package details, doctor experience, recovery support, and follow-up.
Exactly. Thailand's value comes from a lower cost of living, which allows them to offer those all-inclusive hospitality packages. South Korea's value comes from market density. There are so many elite clinics competing, it drives down the price of accessing state-of-the-art tech.
But again, the assumption people make with a 50% discount is that safety standards are lower.
That is where accreditations come in. Both countries boast dozens of JCI-accredited hospitals.
Which stands for Joint Commission International.
Right, and it means they meet strict U.S.-level safety protocols. It is objective proof of safety.
So the surgery is safe, the recovery is managed. Now Maya is at the airport. Does the clinic just wave goodbye?
No, reputable clinics focus heavily on continuity. Before you fly home, you receive a comprehensive discharge summary for your local doctor. And they offer remote telehealth follow-ups to visually monitor your healing.
And listening to all of this, you realize how incredibly complicated it is to coordinate on your own. trying to verify accreditations, decode packages, arrange telehealth across time zones. And that is exactly where PlacidWay steps in.
Yes, because navigating it blindly is just a recipe for anxiety.
PlacidWay essentially acts as your bridge. PlacidWay helps patients compare providers, review packages, ask questions, understand estimated pricing, and request a free quote before making a decision.
It acts as support, not a sales pitch.
Exactly. It's about getting the hard facts.
Which is vital. If we step back and look at this entire journey, embarking on a medical or beauty journey abroad isn't just about changing your external appearance. It's a profound exercise in self-advocacy.
Oh, absolutely.
It requires you to step out of your comfort zone, ask hard questions, and take total ownership of your health, your boundaries, and your personal vision.
It is taking the ultimate level of control over your own well-being. So think about what kind of environment empowers you to do that. The choice is entirely yours, but you don't have to navigate it alone. If this topic connects with what you're exploring, you can use PlacidWay to compare medical and beauty travel options in Thailand and South Korea, ask questions, and request a free quote when you're ready.